Hello, and in this video I will be talking about the rotator cuff injuries, which is the most common presentation in orthopedic clinics because the patient had the pain and they have limited range of motions or the painful movements of the shoulder joints. So what are the rotator cuff injuries or the tear of rotator cuff muscles? First, we have to know that what are the rotator cuff muscles. We actually memorize them with the mnemonic sets: the supraspinatus muscle, infraspinatus muscle, teres minor muscle, and the subscapularis muscles. So these all muscles make the rotator cuff of the shoulder joints. And actually, what is the injuries or the pathology of the rotator cuff muscles? So actually, when the one or more muscle of the rotator cuff are injured, we see that is typically due to tear or tendinopathy or sometimes injured. So the patient will be having the limited range of motions, and so we also have to know, and it's important to know the innervation of the sits muscles. Actually, the rotator cuff or the sits, we can say also sits as the rotator cuff muscles. These are all innervated by the C5 and C6 roots. And now I will explain a bit about the functions and innervations of each muscles, because it's important to know these important characteristics of these muscles. Well, the supraspinatus muscle is innervated by the suprascapular nerve, and its function is to have an initial abduction of the arm, means it abduct the arm from 0 to 15 degree. And infraspinatus muscle, which is innervated by the suprascapular nerve, and it rotates laterally the arm. And the next, which is teres minor, and it is innervated by axillary nerve, and its function is to adduct and lateral rotation of the arm. And the last muscle, which is subscapularis muscle, and it is innervated by the upper and lower subscapular nerves, and its function is adduction and the medial rotation of the arm. So it's important to know the functions of the muscles, and when there is a limited range of motions, we have to suspect the specific injured or the tear of that muscles which are responsible for that movement. Here shortly I explain about the epidemiology of the rotator cuff injuries. The most common muscle which is injured is supraspinatus muscle, and it occurs in adults most commonly. And the risk factors of rotator cuff injuries are older ages due to degeneration of muscles and lower ability to work, and the smoking may also predispose for the rotator cuff injuries, and the repetitive overhead region. For example, the plumbers or who are making buildings, these people are more probability at great risk to have a rotator cuff injuries. Well, we don't waste time, and in this slide I will talk about the pathogenesis, like what are the causes of rotator cuff injuries. Mostly the acute avulsion injuries, which are followed by trauma, may cause tears of the rotator cuff. So the chronic degenerative tears, which are typically in older ages or due to some other rheumatologic diseases, may cause injuries. And I already told the repetitive overhead motions are also the predisposing factor of the injuries, and the tendon weakening which is due to the degenerative changes, may also cause tears, and the chronic impingement of the shoulder head is also causing tears in some cases, and the associated conditions which are causing the rotator cuff injuries are the biceps tendinopathy and the osteoarthritis in rotator cuff injuries. These two are most important to know in that case. For example, if the patient has the limited range of movements, we will suspect the tear of the rotator cuff muscles. Now I will talk about the presentation, symptoms and signs and specific test positivity in the rotator cuff injuries. Mostly the symptom which is most common is the shoulder pain, which is exacerbated by sleeping on the affected shoulder. The patient will have complained that while he sleeps on the shoulder, he has the pain. And when there is reaching overhead and there is limited function of the shoulder because of injuries, and so the physical exam, when we palpate that, we see severe focal tenderness at the insertion of supraspinatus, that is the position at the anterolateral shoulder. So we have seen the decreased active elevation, but the normal passive range motion is seen in that cases, means the rotator cuff injuries. So the first test we see here is Hawkins impingement test. When the patient is seated and elbow is flexed 90, patient is allowed to have a passive internal rotation of the shoulder. So if the pain has felt by the patient, the test is positive, and we see the specific rotator cuff muscle injuries. In Neer impingement test, the patient is asked to stand and internally rotate the arm, and there is a passive elevated arm. So if the test is positive, if there is pain, so there is painful arc sign, we can say it. So other signs could be pain with active abduction between 60 to 120 degrees, and the empty can test, which is the patient with arm elevated to 90 degree and the elbow is extended and the thumbs is down. It's like someone is emptying can. So the physician applies a downward force on the arm while patient resists. So test is positive if there is pain. Empty can test, it has the 90% specificity for supraspinatus pathology. So imaging, that is the radiography, and it is indicated for all patients as an initial imaging. So in radiography, we see the loss of subacromial space because there is upward migration of humeral head. And the next step is MRI, which is indicated if the radiography is normal, but there is more suspicions for rotator cuff injury. But it is that the MRI is not indicated for all patients, and the MRI is most accurate test, but we should avoid as initial imaging study for the rotator cuff injury diagnosis. While talking about the differentials of the rotator cuff injuries, the most common is adhesive capsulitis, in which both active and passive range of motion are limited. That is the distinguishing factor of rotator cuff injuries from the adhesive capsulitis. So how to treat the rotator cuff injuries? We start from the conservative therapy and then the medical therapy, at the end operative therapy. So first we will talk about the conservative therapy, which is the physical therapy, and it is indicated for all patients. In medical, which is indicated mostly for all patients, that is the NSAIDs, which mostly reduce the inflammation, but not inflammation, actually it reduces the pain. And we give the other pain management things, and the steroid injections is also indicated for patients who fail NSAIDs as pain management. In operative things, we do the surgical repair of the rotator hinges. If patient has complete tears of the rotator cuff muscles, or the patients who fail all other more conservative management in 3 to 6 months. So at the end, we talk about the complications of the rotator cuff injuries, that is the functional limitations of the shoulder joint, where the patient will not be able to move for functions, but other is the adhesive capsulitis. In prognosis, we can see that re-tear of the rotator cuff muscles may also occur. Please subscribe it for the other more videos on orthopedic series.